Okay, thank you everyone. My name is Dr. Arisapta Aji. I am from Public Health Department, University of Alma-Ata. At this time, I want to present our research result about eating habits and lifestyle changes during the COVID-19 pandemic among Indonesian students. This was a result from Indonesia Dietary and Lifestyle Changes, or IDLC study survey. We started the survey about last April 2021. Right now, we already have almost 2 years of life with pandemic COVID-19 since Indonesia confirmed the first case back in the March 2020. Indonesia had more than 4 million positive cases and more than 132,000 deaths. This condition has made people more concerned with their daily hygiene habits and has made people adhere with the health protocols to prevent the spreading COVID-19. This pandemic changes how people live, including the students, so that having an unhealthy lifestyle cannot be denied due to social restrictions, school being online, and no more freely doing outside activities just like before. Indonesian students' diet may be influenced by these situations and associated with higher risk of adverse outcomes from COVID-19. Some policies have been made by the government, such as large-scale social restrictions, study or work from home, and quarantine to decrease the spreading COVID-19 in Indonesia. The situation may affect their lifestyle behavior, eating habits, and also student mental health. These come up will determine the student's health and performance status. Furthermore, the study aimed to investigate the impact of COVID-19 on lifestyle and eating habit changes among university students in Indonesia during pandemic. We did cross-sectional study from April to June 2021. The survey was conducted from the West, Central, and East regions of Indonesia. We targeted students with a diploma, bachelor, master, and doctoral degree. Quality platform was created to collect data, analyze data, and also we utilize any social media to deliver this survey informations and work together with the university student unions to reach a maximum participants of survey. We collect personal data such as socio-demographic questions, location or place of residence, level of educations, and the anthropometry data based on self-report of student height and weight, and we try to calculate the student body mass index. However, this may have a significant bias. Eating habits indicator of the student with adherence to balanced nutrition guidelines and trend to eat immune booster foods. Lifestyles indicator including their smoking habits, sleep, and groceries before and after pandemic, also physical activity during their daily life, also created in this survey. There were a total of hundreds, 1,600 subjects who participate in our survey, but only 952 subjects were collected after cleaning the data. Most of them from the west region of Indonesia, 76.4%, and most of them were bachelor students, female students, and with normal BMI status. The majority of all students raised their concern on the trends of eating the immune booster foods. Male students had frequently smoked cigarettes more during pandemics than before, if compared to the female students. Eating habits of Indonesian students found various results within the variable in the study. The adherence to a balanced diet showed that Indonesian students mostly obeyed the balanced nutritional diet. More than 60% of participants who ate a balanced diet applied good and healthy hygiene, regularly exercised, and regularly monitored their body weight during the pandemic COVID-19. It was found that most of the category immune booster foods in the study was high in all categories, including multivitamin, fruits, vegetables, honey, milk, and herbal drink consumptions. The Indonesian student physical activity study showed that more students still regularly maintain their balanced diet whilst having moderate to high physical activity levels during pandemic COVID-19. We compared smoking, sleeping, and shopping habits of Indonesian students during the pandemic and before pandemic. This was not an actual comparison as they had to remember their lifestyle before the COVID-19 pandemic. The comparisons between variables found that what habits were changed during the COVID-19 pandemic. Students had no significant difference between before and during the COVID-19 pandemic on smoking status, while the number of students not smoking were mainly from female students, which is 71.6%. This study found that student sleep habits and grocery shopping made a significant difference between before and during COVID-19 pandemics. Our study conclude and also have recommendations to Indonesian students during the pandemic. In this study, we have provided for the first time data of Indonesian students on eating habits, lifestyle changes, and the adherence of balanced nutrition during pandemic COVID-19. Majority of students have raised their concern on trend eating the immune booster foods, adhering balanced nutrition recommendations, physically active than before pandemic, try to be contact free with tend to have online grocery shopping to reduce COVID-19 spreading and improve the sleeping habits. Thank you very much for your attention and see you again.